The best way to get the message across is for you to hear from everyday New Yorkers who have received the vaccine, and so they can explain why it's so important to them and their families, why it's so important to you. And so we've got three folks who work at health and hospitals, in our New York City public hospitals and clinics, who do such important work for all of us, who really are heroes for what they've done to protect their fellow New Yorkers. And we want them protected, but we want to hear their voices because they made the choice to get the vaccine, and it's important for you to know why and what it means for you and your family. So first, let's hear from someone who helps every day, the people of the Bronx. He works at North Central Bronx Hospital for our health and hospitals system, and we welcome Kevin Cruz. Welcome, Kevin.
How you doing?
I'm doing good today. How about you?
I'm doing good. I got my shot and I'm feeling good, no side effects, nothing.
Amen.
I work at New York City Health and Hospitals, North Central Bronx, and I've been here since 1978. And I was here at the beginning when AIDS was breaking out. We've been through, a lot of things here. We've never seen anything like this. This virus it's affected my family, my son, his wife, my stepdaughter, her family in Florida. It's, to me, not a matter of if you're going to get it, it's when you're going to get it, or someone close to you is going to get it. I don't consider anything that I do heroic. I consider that I'm lucky for working with heroes, the nurses, the doctors here, all the staff. They were incredible through this whole thing. The hours they put in, seeing them coming in, the way they risked everything. At the beginning of this, we didn't, no one knew whether you were going to go home. When you came on a shift, you didn't know if you were going to get out. You really didn't. You could see it in the people's eyes, the nurses' eyes, the doctors' eyes. You didn't know if you were infected. No one knew anything. New York seemed like it was ground zero for this, and there was a lot of training going on, and you can see that the people were doing the learning and going through it. I'm hoping that everybody comes to take the shot. To me, it's a no-brainer when you come in with the idea of, you don't know what the side effects are. You know what the side effects of COVID are. We were filling, refrigerated trucks with the side effects. We need to take the shots. We need to do what we've got to do. This is the beginning here. I count myself as lucky for having gotten the shot and lucky to be able to help these people who are dealing with it every day. Really, it's just hard to put into words what we've been through here. And when I hear people saying that the shot isn't safe, I don't know how to argue with them anymore. I don't know what proof you would need. Having been in this building during this time and seen what we've been through, I don't know what they're waiting for. I just think it has to be something that we all have to do.
Kevin, I really appreciate that, and I think you just gave all the reasons in the world right there. I just think you spoke from the heart about what we saw, what we know, and I really appreciate the point you made. People worry about side effects. We know the side effect of getting COVID, and it's how horrible it can be. We know that can lead to people losing their lives or lasting consequences. So I want to thank you for putting it in real perspective, that this is something that people need to do, and do it for yourself, do it for your family, but also do it for the healthcare heroes who were in harm's way but fought through to save us. Kevin, thank you. That was very, very powerful.
Thank you very much.
Thank you, and thank you for all you do. Everyone, I now want you to hear from someone who does so much for us in Queens. Suja Mohan is the Director of Nursing for the Emergency Department at Queens Hospital, another place that was right in the epicenter of this crisis. Thank you for all you've done, and tell us what you think about this vaccine. Suja.
I'm the Director of Nursing for the ED at New York City Health and Hospital, Queens, where I have worked for the past 10 years. I witnessed what this virus does to people's bodies firsthand, and not just older at-risk population. Young, seemingly healthy people were becoming critically ill from COVID-19, and it was terrifying. And still, healthcare workers, my teams included, heroically rolled up their sleeves and saved lives, putting themselves at risk or isolating from their families for weeks at a time. I was eager to be one of the first hospital workers to get a COVID-19 vaccine, not just because of what I experienced during the surge in March and April, but because I believe in science. Science tells us that this vaccine can help slow or end this pandemic. It can help prevent people from passing away without their loved ones by their side. It can help make healthcare workers less afraid of their job or of bringing home the virus to their families. This is what the pandemic has been like us in hospital for nearly a year now. I urge everyone to consider getting the vaccine and do their very own research, turning to trusted scientific outlets. You can also speak to your healthcare provider with questions or concerns. This is our best chance to help end this horrible pandemic and save lives. Once again, I urge everyone to get this shot of hope. I thank you.
Thank you so much, Suja. Thank you for all you have done through this pandemic to save lives, to help support all your colleagues. I know it's been really tough, but thank you for your leadership and thank you for your testimony today on how important this is. I want you to hear from one more New Yorker, and this is someone who watches out for the people who do this crucial work, watches out for our healthcare workers, watches out for folks who are in hospitals and need solace and comfort and support. Very, very crucial that we recognize that all the members of the clergy who are there for people in their hour of need help sustain us and have helped to sustain us through this horrible time. So he does his good work at Coney Island Hospital, part of Health and Hospitals, a place that also really, really struggled and fought through the worst of the coronavirus crisis, and really appreciate his leadership and his voice today. My great honor to introduce Rabbi Jonas Brunswig.
Good morning.
Good morning, Rabbi.
Good morning. My name is Rabbi Jonas Brunswig. I'm one of the chaplains in New York City Health and Hospitals Corporation in Coney Island Hospital, where I provide spiritual support throughout the pandemic to patients in the ED, ICU, and any other unit within the hospital. I'm not a scientist or a doctor. I'm lucky to work with the people here at Coney Island Hospital. I made the decision to get the COVID-19 vaccine by relying on the clinical judgment of medical professionals and my doctors who understand the ability to fight off the virus and to keep us all safe. Given that the doctors have been fighting this virus and saving lives throughout this whole pandemic, they trust the vaccine and they're taking it themselves. I think it would be very wise for everybody else to consider, like the doctors do, getting this injection virus, the vaccines against the virus as well. I decided to get the COVID-19 vaccine to be able to continue my work providing spiritual care to people in and out of the hospital. Also, to protect my family, my loved ones, my congregants, my patients, hospital staff, and anybody else I come in contact with. I took the vaccine because I don't want to get the COVID-19. I certainly don't want to give it to anybody else. Thank you.
Thank you. Rabbi, thank you so much. That's such a clear, powerful message. You don't want to get COVID-19 and you don't want to give it to anybody else. Well, listen, everybody, the rabbi said about as clearly as you possibly could. This is why everyone should take this vaccine, because Lord knows you don't want to get this horrible disease, and you certainly don't want to pass it on to those you love. So we're going to keep giving you the opportunity to hear from your fellow New Yorkers in the weeks and months ahead to really understand why people believe in this vaccine and their own personal experience with it. I think that's going to be what's most compelling to people. I really want to thank all our guests today for all they do for us and for also helping New Yorkers to understand this vaccine and believe in it.